Pete Sepp joins us. He is president of the National Taxpayers Union. And on this very, very topic, it's perfect that he's here as I talk about my sponsor. Pete, I welcome you in here this morning. Good morning to you.
Thank you very much for having me.
Everybody is very, very wound up if they're on Obamacare right now. I think I read something like 28 million Americans have been on it or are on it or something like that. And I don't know anyone specifically, but from what I read and hear, yeah, prices went through the roof. It was always designed to be a disaster if it wasn't subsidized. You guys at the National Taxpayers Union have some thoughts on this, though.
Yes, unfortunately, we're learning this lesson again. Once you create a federal entitlement program supported by taxpayers, all 150 million of us, and the benefits are concentrated among several million or tens of millions of Americans, you're shifting all the accountability, all the transparency, all of the market forces that make our system work into government. And that was the fundamental mistake of Obamacare. It's why we should not have had Republican defectors in the House of Representatives voting to extend all of the taxpayer subsidies for Obamacare for another 3 years. We've got a chance to push back in the Senate. We need proactive reforms in order to say we have an alternative to more tax dollars being sunk into more entitlements. The president's plan, called the Great Healthcare Plan, released last week, is a good start in some areas, but he's treading on dangerous ground when it comes to drug prices. We've got work to do here.
Let's talk about the president's plan. What do you know about his Great Healthcare Plan proposal? What do you... Let's start with the negative and work toward the positive. What about it concerns you before we get into what's positive about it?
The single biggest concern is that the plan would create what's called most favored nation drug pricing. Essentially, it would link U.S. drug prices to the prices that other countries, basically socialist countries, pay for their drugs. Well, they're underpaying for the medications that we invent in the first place. They're overtaxing their citizens 30, 50% more than we are taxing our citizens. They, according to their purchasing power, are paying only about half as much as we do for our prices, for our drugs. Why would we emulate that? What we need to do is make them pay up, not make us the beneficiaries of price controls, which are of no benefit at all. Economists have said this for centuries. If you control the price of a good or service, you get less of it. We don't need less innovation in drugs because innovator drugs save taxpayers and patients money by shortening hospital stays, obviating doctor visits. We need more of that development in the United States, not less.
So European countries, effectively, many of them, subsidize drug prices so the citizenry doesn't pay as much as maybe we do here in the United States. Is that about right?
Yes, and they force our companies to sell the drugs at a lower price through reference pricing or compulsory licensing. Complex terms, but it basically boils down to extortion.
And if these price controls in Europe and other places around the world weren't in place, if the true free market of drugs were at work, it's your belief that prices would come down here in the United States and around the world, meaning there would be more cost sharing for development costs and other things. We in the United States bear the brunt of so much of that because of these price controls around the world. Is that the point?
Oh, yes, absolutely. Again, European countries especially are paying about half for their drugs based on their purchasing power and their economy than we are for ours. And that's free riding. We need to end that free riding, not emulate the free riding. And unfortunately, the president's plan is going in the wrong direction there.
Pete Sepp is with us, president of the National Taxpayers Union, NTU.org. What about domestic drug production and research versus foreign production and research. President Trump, through tariffs and other initiatives, has been trying diligently to get all kinds of business, not just manufacturing, but pharmaceutical as well. And many of them have made announcements that they are going to come here, back to the United States, invest here, develop and whatnot. How critical is that to putting us on better footing cost-wise, do you think?
Yeah, I think that's important. Now, the One Big Beautiful Bill Act made several key pro-business tax provisions permanent, full and immediate expensing of factories so that you don't have these 30-year tax depreciation schedules, a research and experimentation tax credit and expensing made permanent. So that encourages the kind of research we need in the pharmaceutical sector. The president has negotiated, rather than compulsory price controls, negotiated price reductions with about 25 or so pharmaceutical companies. Those are all positive steps. And we have to remember, no other country in the world but us has almost 90% access to innovator drugs that are developed around the world, and 90% of prescriptions filled here are for generics. That is the most elegant balance when it comes to prescription drug policy in the world, bar none. We cannot afford to tinker with that. We should be lifting it up and encouraging it.
And yet what we learned during the COVID era was, and I was ignorant to it, I'll be perfectly honest. I had no idea how much of our medicine is not made here, but in places like China. And when that supply chain comes to a grinding halt, that puts us in a bad way, doesn't it, Pete?
Yeah, a lot of the ingredients come from abroad. They're called APIs, and that's an important consideration. Another important consideration is making sure that the development pipeline continues here. If you have U.S.-based APIs, you've got to do this carefully and gradually. If you have a good trade policy that allows APIs to come here and to go out to our allies, good trade, again, with allies rather than adversaries, and you have smart tax policy to support it all, taxpayers win, patients win.
What do you like about this great healthcare plan of President Trump's? And I'll tack on, how likely is it we'll see Congress do anything with it?
I think there are several desirable elements. They actually are part of what's called the Most Favored Patient Plan. That's something that Steve Moore, the Committee to Unleash Prosperity, and several dozen organizations like mine, National Taxpayers Union, have signed on to. President Trump's plan would reform the secretive relationship between pharmacy benefit managers and insurers. That ends up creating middlemen, and you don't get drug savings passed along to patients. Direct-to-consumer purchasing of medicines is something that the Trump plan should be examining. We hope it will. There's also work on getting the money directly into patients' pockets. Right now, insurers tend to get a lot of the Obamacare subsidies. They don't pass them along to patients. What if you cut out the insurers and said to a patient, here is the direct subsidy the insurer would otherwise get. Go out and purchase your health care in the open market. That is the vital direction we need to take with healthcare reform. What should matter is not insurers, not hospitals, patients and taxpayers. You'll save a ton of money in the system, and you'll get better care at the same time.
By the way, it's stunning that it is still law that you're technically required to purchase it because of the twisted in knots ruling from John Roberts. But it didn't work. People are still preferring to pay the penalty for not having health insurance rather than pay for the health insurance. So I would love to see that repealed too, personally. Pete Sepp is president of the National Taxpayers Union, NTU.org. Pete, it's great to catch up with you. Thanks for your perspective today.
My pleasure.
For full shows, live and on demand, it's Salem News Channel.